right, good morning. Today is Tuesday, June 11th, and we are at the Legislative and Human Resource Committee meeting. Our first item on our agenda is public comment. Is there anyone here that would like to address the board? And please limit your comments to no more than a minute and 30 seconds.
Probably. I think I could say enough in that.
You'd still be on time.
Probably. How y'all doing? I'm D. Jones. I'm a passionate entrepreneur and visionary. I'm also vice president of this eSports energy drink. I told you guys about this eSports energy drink that is developed in Detroit, and I'm the vice president. I just happen to live here in Kent County, and we just got done shooting the production Gamers. I was in there with my Cartiers and my Gucci bucket hat, so y'all know I was looking stylish and fancy and icy as usual, you know what I'm saying? And I think people are actually gonna like the story. I think people will like the products. You'll also see this eSports energy drink in the production itself, so it's gonna get a lot of cool attention. It's gonna get a lot of positivity. I'm very excited for the things that I've got going on with esports. I'm disappointed that we couldn't do the esports finals on June 8th. I put a lot of passion, love, and energy into it, but I know that we're in a better position now because our local school district, GRPS, has invested into esports. We'll actually have teams for our high schools and some of our other schools. And I'm just very excited for them to actually invest into infrastructure so we can actually get some kids some scholarships and get these kids some possible full rides or some kind of scholarships to different universities and colleges across the nation. I've also been helping GRCC. I've helped KDO start esports, and they've actually connected them to Epic Games, and now they're doing an educational competition where kids can develop their own Fortnite island, and the first place prize is $1,000 and 13,000 V-Bucks. That's a lot of V-Bucks for those kids, and that's a lot of cash for kids to actually learn things like software development, game design, all of those cool things that are tech savvy and that the future holds. And so I'm just very, very excited for the cool things. I'm not disappointed as I thought I'd be because I've already failed before, and I'd rather try in front of everybody and fail than to never try. And so I'm just excited for the cool things and the things that I got to look forward to, just because I know it's going to impact our community. I know that how the importance of Detroit's culture and influence. And I'm from Chicago, so I'm not, you know, a swagger jacker. I got my own style, and everybody likes my style in Detroit. So I know in a couple next years, you know what I'm saying, I'll be getting a lot of compliments, and I'll be bringing some cool, positive things to our community. And I believe in the law of attraction, and you are what you attract in. I just seen a large cash truck while I was holding my esports energy drink, so I think I'm gonna attract a lot of cash in the future, and I'll be developing some equitable jobs and getting people out of poverty and really truly developing an equitable business plan and a feasible business plan and being a global business leader. I'm going to the Van Nando Trade Center's event where I can learn to export and import, and they're going to give me step by step, and I'll be actually connected with people and suppliers at that event also, and also eating. So I'm gonna be thinking about those billions and trillions as I eat and getting to learn all of this info so I can help the community and help Kent County grow. And I'm just very excited to give back to the community. I'm going to be a billionaire one day for sure.
Thank you, D. Jones. Is there anyone else that would like to address the board? All right, seeing no one, that portion of our meeting is closed. Approval of last meeting's minutes. Do I have a motion, please? Motion by Teal, support by DeBoer. Any comments, questions, changes? All right, seeing none. All those in favor, please say yes. Yes. All those opposed? Those have been approved. All right, next item on our agenda is the state legislative update. Becky Beckler. Thank you, Becky. Welcome.
Good morning.
Good morning.
It's nice to be here on a beautiful sunny day in Grand Rapids. Today's January 11th, and the legislature, according to their own rules and regulations and legislation that they've passed, need to have a budget done by June 30th. They still do not have targets. I was texting with the speaker this morning, and he's hopeful that they will have them yet this week. But they still don't have targets, which means they've got a ways to go trying to complete the budget, and we only have 2.5 weeks, if you will, to get that done. Now, if they don't get it done by June 30th, there is no penalty for them not to get that done. Statutory, they just need to have a budget in place by September 30th. So we do have some time. Other legislatures have gone right up until the deadline of September 30th. So there is no really panic, other than the school system, I think, would be very disappointed because they need to set their budget for their school year. And I think on the local government, we also would like to know how much money we have available to us as we set our budgets. But that's where we sit today. We continue to work on the Revenue Sharing Trust Fund. We'd like to see that incorporated. It has different versions from the House and the Senate. We'd like to see either one, but we prefer the Senate because that does give more money to local units, especially the county. But we would, I think at this point, just want to get that Revenue Sharing Trust Fund in place and get that going. So we continue to work with MAC on that. One of the things that is also, I think, complicating the issue is Senate Republicans, and if you'll recall, the Senate is important on the budget because they need 6 Republicans in order to get immediate effect. You must have 2/3 majority to get immediate effect. The rules are different in the House, they don't need that, but in the Senate, they need immediate effect. So it's important that the Democrats work with the senators to make sure that they've got 6 that are willing to do that. Right now, the Senate leader has indicated that he will not allow, or I think all of them are in agreement, that they will not support any budget if it has the reduction in payments for the public school retirees and health care. The governor's budget did include that. It's about a $300 price tag. When the legislative leaders started last week, I think on Friday, negotiating, school aid should have been pretty easy, but it's not, and I think that is complicating it because if the Senate Republicans refuse to vote on it unless they change that, they're going to have to figure out another $300 mechanism. And I think the governor had wanted to use that for MyLeap, that new department that she created. So she'll need to do some negotiating either with the Senate Republicans to get them to change their mind or pull that out in order to get immediate effect. Another thing that is complicating the issue is, if you recall, last fall, the governor put together, I think it was almost like a mini State of the State address, and a lot of it was on economic development. She wanted some R&D tax credits. She wanted more money into the SOAR, which is that economic pocket of money, to allow the MEDC to incentivize businesses to come in Michigan or incentivize businesses in Michigan to increase their projects and develop in Michigan. She wanted more money in the SOAR and also a program to incentivize businesses to hire higher employee content and give them tax breaks for that. Some of that has hit some roadblocks. The R&D tax credit, I think, is in a good place. The problem is it has a $200 million price tag, so again, that's part of the budget negotiations. But that's moved through both the House and the Senate and is just waiting on final approval. House Democrats came out with a new SOAR reform proposal last week in Senate and House Economic Development Committee. They're considering linking next year's budget to a proposal that could reform Detroit's Renaissance Center, and that would make it into a new housing and regional transportation hub. They would create a actually regional hub authority. It's called the Mobility Trust Fund, and if enacted, over $2 billion would be used towards public transportation. And local governments and transit authorities would be eligible to receive funding if that is implemented. It would also call for $200 million for affordable and workforce housing, as well as $250 million annually dedicated to grants for large corporate development. Of course, all the focus right now is on General Motors and wanting to revamp the Renaissance Center, which they have left their corporate headquarters. But that's also part of the budget conversation. I know that the governor's priority is to put more money into SOAR. She dedicated or proposed $500 million ongoing within her budget, and we'll see how that develops as far as how they want to implement that, but that's also another point. Some other bills that are moving through the legislature that I think would be of interest to the county is there is a proposal that would protect just judges. We've had some issues where judges have been, unfortunately, people have come to their homes and tried to either verbally or physically attack them. So this is a proposal that would, if a judge asks, their personal information, including street address, phone number, and tax ID number, be shielded from the public. It would actually codify federal legislation, but it's something that was taken up in House Judiciary. Representative Kelly Breen, I believe, plans to move it out of committee this week. Another piece of legislation that's now in the Senate Local Government Committee, House Bill 5203, would, as introduced, allow the Sheriff's Department to rehire retirees without jeopardizing their retiree benefits. MAC was able to get an amendment on that to expand it to all county departments would be able to rehire any type of retiree without affecting their retirement pension. So that would also help any counties that wanted to rehire due to some shortages. We're also working on or modifying some legislation. If you recall, in the governor's budget, she had $30 million proposed to allow the uninsured costs of jail inmates, and it's something I know that's been very critical to Kent County. The Department of Health and Human Services is moving forward of that. It's a 6-step process for them. They're at step 3 in order for them to apply and implement their waiver approval, but they are moving forward, and we're watching that very closely because I know it's very costly for counties to have to pay for individuals' health care that otherwise would be Medicaid eligible if they were not incarcerated. So it's something that's been a priority for a long time, and we'll continue to work on that. There's also some legislation dealing with data centers. It would expand and exempt data centers from sales and use tax. It's moved through the House and the Senate. It's caught up in a little bit of politics right now. There are some Democrats that are concerned about the amount of water and energy that data centers use, and there are some Republicans that are concerned that perhaps it doesn't create the jobs that they wanted if they were to get this tax credit. But the proponents indicate that, look, during the AI, and we need a safer and perhaps larger data centers, and why not make Michigan that center of those data centers? Michigan is having competition from Ohio and Indiana and Wisconsin that offer similar tax incentives, so there's consideration to make us more competitive, to make sure that we are perhaps a data center hub. So those are all legislation that is clearly going on right now. It's not a robust schedule. A lot of it is because last week the House and the Senate were not in session due to the Detroit Policy Conference, and now they're really focused on the budget. So they're trying to get the legislators to focus on their individual budgets so they can get out by the end of June. If not, I think you'll start to see them return throughout the July, August, and September. Since it's an election year, that's something they'd prefer not to have to do, but that seems to be the reality if they don't get it done by June 30th. I'd be happy to answer any questions.
All right, thank you, Becky. All right, commissioners. Commissioner Ponstein.
Thank you, Chair Burrow. Becky, thanks for being here today. Thanks for driving all the way over. You had mentioned, I caught my eye about counties can rehire former employees without affecting their pensions if they're retired. Now, when counties hire people back in, are we then forced, we're already paying a pension to them, to start another one up? Have they addressed that?
To be honest with you, I don't know the mechanism. We're simply just allowing this piece, but I can certainly check whether, and perhaps.
No, they don't start working on another pension.
Okay. And then secondly, a couple of years ago, they did a revamp of the campaign finance reports where now people that are sitting in office in a non-election year still have to file reports. A lot of people got caught up on that, said, you know, why do we have to file? Some didn't file, got a fine, sizable for some people. But then after paying the fine, they thought that maybe they, you know, took care of it to find out that, well, not only did they have to pay a fine, then they had to submit a brand new form. And commissioners have been kicked off the ballot across the state for these little, you know, nuisances they are, because, you know, it's tough to find people to run public office, let alone all these little rules and regs that are coming out of Lansing. Is there any talk of reforming the campaign finance laws in this state? Because even the years that we do file, they really don't line up with any election. They're well after the election's over or well before. So if you're searching for a smoking gun, you know, those should be closer to the election date, shouldn't they?
Well, I will say that campaign finance reform and issues such that you've raised have been a conversation that has happened in the legislature. Whether they actually can fix the problem is still unknown. I think you saw after the Detroit Policy Conference, there were a lot of articles about not only campaign finance reform, but what individual legislators or local must report. And I think you're going to see probably after the election some type of legislation introduced trying to move. They struggle just to get transparency legislation through the legislature. They've introduced it, they try to move it. Hopefully, I know Senator Moss has some transparency legislation that he would like to get through the legislature, and he wanted it done by the end of the year. We'll see if he's successful, but they're definitely working on things. Whether it fixed the problem you've identified, I don't know, but it's something worth having a conversation with him about for the future legislation.
All right. Any other commissioners? Commissioner Diaz.
Thank you, Chair, and thank you for being here. I'm wondering if you have any more details on the SOAR legislation. I know that there is a lot of controversy at the moment, specifically because in the last couple of years, all of these millions of dollars that have been offered to corporations to bring their businesses to Michigan, and oftentimes these businesses end up creating jobs that pay less than the state median wage. I know that there are a couple, at least one legislator on the majority who is hesitant, to say the least, to provide more corporate tax breaks. But are there any current discussions around if this SOAR reform is going to pass? Any reforms around requirements around the jobs that are created?
I'd be happy to send you both. There's probably two proposals, one that passed by the Senate and then the one that I just referred to that is up in House Economic Development, I think this week, so you can take a look at it. I haven't seen specific requirements about the level of pay for SOAR projects, and I think part of the strategy is right now they just aren't even agreeing on the bigger principle of whether SOAR is going to be included in this budget, and if so, how much. So I think those are a little bit larger conversations versus the specific requirements. But I'd be happy to send you that package and continue to update you. I think we'll get more information over the next week or two. If in fact the budget targets do come into fruition,
Yeah.
then I think that we'll have more clarity at that point. But let me get you at least the two proposals so you can take a look at that.
Okay. I've been trying to have conversations with my state rep and a couple of others around the minimum wage. It's very likely that any day now the state Supreme Court is going to rule that Adopt and Amend is unconstitutional, in which case the state minimum wage would jump to, I think, a little over $12 or $13 an hour. But with that, I believe I've heard that the governor has said that if that were to happen, that she would be concerned with the effect on small businesses specifically, and that they would try to slow down the increase. But that in exchange for that, they would raise it to $15 an hour. And I was just wondering if you've heard anything along those lines, if you've heard anything along what current plans are around the minimum wage.
I do believe legislators do have legislation prepared. I think Representative Hoskins, if I recall, might have that legislation, but let me confirm that and get that to you. So there are individual legislators that are putting legislation in place should that happen.
Okay. And then just lastly, I know that the SOAR has a component around housing in it, but I've seen, a bunch of stats and studies in the last week that housing is the #1 concern for people in general, especially young people, but people in general. And so whether there's something that happens with SOAR or somewhere else, I would just hope that that you can tell the legislators that things are not easy out there. And I know that it's easier for people who are in Lansing, for electeds who are in Lansing, to get more disconnected from their communities than people like us. We're a lot more connected and a lot closer to our communities. So just a reminder to the people who are in Lansing would be great.
Yeah, absolutely. And I know in the last budget as well as this budget, affordable housing is a priority for the legislative leaders. They do recognize that we have almost a crisis here in Michigan as far as finding affordable housing. So they've continued to prioritize by putting in a significant amount of money and programs to that, but we'll continue to do more. But I will make sure to pass that along.
Cool. Thank you.
Thank you.
All righty, thank you. Is there any other commissioner questions or comments? All right, thank you, Becky. Appreciate your drive over, and hopefully you get a lunch out of it or a breakfast out of it, or, you should anyway, so.
Thank you very much.
Appreciate your time.
Yeah.
Well, I think Lori is, so. All right, next item on our agenda is the health, from the Health Department, the performance measurement review. Adam London.
Good morning, Commissioners.
Good morning, Adam.
I think this is the 12th year that I've been here for Performance Measures Report. And in that time, I've learned that with 75-ish programs of the Health Department, it's not a great use of our time to go through output measures and widgets, but rather to talk more about high-level public health and what's happening in the community. So that's what I'm going to do, kind of starting at a 30,000-foot level and then kind of working down into some detail with about 3 different issues. But I would like for each of you to know that you have an invitation from me and from my senior leadership staff. If there's any program or service that you'd like more information about, or would like to do a deep dive in, let us know. We're happy to spend as much time with you as necessary to get that information to you. It's really important as you represent our community. Our mission at the department is to serve, protect, and promote a healthy community for all. And as you and my staff have heard before, the most important words are the first and the last: serve all. And I hope that's the ethic that our team has and the ethic that our community feels when they interact with the health department. So I'll start off with the county health rankings. And every year, the Robert Wood Johnson Foundation funds this large project that's conducted by the University of Wisconsin, looking at the health relatively of all the counties in the U.S., and then categorizing them based on two categories: health outcomes and health factors. That first category is health outcomes, and as you can see from this scale, they're kind of ranged from least healthy in the U.S. to healthiest in the U.S. Kent County is kind of the tail end of the first quartile of counties in the highest performing quartile. Good, but there's room for improvement, of course. Some key findings from health outcomes: that life expectancy here in Kent County is on average 78.7 years, which is a little better than the Michigan average and the national average. However, there's a devil in the details. I'll get to it in just a moment about life expectancy. Premature death, which is measured in years of potential life lost, is a measure of if you expect 75 years, any years of life that are short of that. So if a 50-year-old here in Kent County dies, there would be 25 years of potential life lost. And those taken together and then turned in a rate, years per 100,000 of population, gives you this measure, which is an indicator of what's happening in the community. Do you have high infant mortality? Do you have people dying in accidents and overdose and the things that happen earlier in life? We're doing really good on that measure overall. 6,500 years of potential life loss per 100,000 population, which is significantly less than the state or the national average. Poor mental health and poor physical health days. This data comes from survey respondents who are answering the question, how many days in the last 30 did they feel so poor that they couldn't carry on their normal activities? And here in Kent County, we're doing better than the state number on both of those measures, poor mental and poor physical health days, but a little bit poorer than the U.S. average. So that's a summary of the outcomes. But when you do that deep dive into life expectancy, so again, 78.7 years overall, but there's quite a range based on race in Kent County. If you look at the bottom, the number for our white residents is 79.5 years on average. At the high end, we have our Asian residents who have a life expectancy of 88 years. At the low end, we have our black residents with a life expectancy of 71.4 years, so over 16 years of difference between race groups in Kent County. Our Hispanic residents are at about 81 years, so we're kind of all over the place here. Lots of lessons to be learned from that, but it is something that we should all have on our radar as we think about the people who live here in Kent County. When we talk about health factors here in Kent County, these are behaviors and environmental things that contribute to those outcomes. And here again, you see that we're kind of in the tail end of the first quartile, toward the healthiest end of the scale, but there's room for improvement. The good news within the health factors is that we do really good, better than or equal than the Michigan and U.S. rates in categories like smoking. We have a little lower obesity rate here in Kent County. Food index, which is a measure of access to nutritious food, we're doing pretty well. Physical activity rates are a little lower. Unsafe housing, which is not only is there housing available, but what's the quality of that housing? Do we have issues with lead, with water supply, with wastewater? Are the roofs caving and things like that? We're doing a little bit better than Michigan and the state, or the U.S. Education outcomes a little better. Children in poverty a little lower than the national rate. Primary care and mental health providers, we do really well on that measure here. We have more primary care providers and mental health providers per population than what we see at the state level or the national level. Flu vaccination rates a little higher than expected, or than those averages. Overdose deaths a little lower, and there's many more. But I also want to mention the bad and the ugly, which is that the success rates for each of these measures are often not equally experienced, as you saw in life expectancy. Also, there are categories like excessive drinking, where we have a little higher rate here of reported excessive drinking. A higher rate of our automobile accident fatalities have alcohol involved. And our rate of sexually transmitted illnesses is quite a bit higher than the state and the national averages, which is really a matter of chlamydia. Our chlamydia rates are higher here than we would like to see. Air quality is another area where we don't perform as well as the state or the nation, and I want to show you this graphic, because I've shared this with you in the past, with this conversation of air quality, especially as it relates to particulate matter, which is the small, fine particles in the air that can come from a number of sources. They can come from environmental sources like pollen and dust. They can come from manufacturing and industry. They can come from wildfires, as we saw last summer. We have a higher rate of particulate matter in our air here in Kent County than the state or the national average. But the good news is we're trending in the right direction, and there's a lot of reasons for that. A lot of the sources of our poor air quality here in Kent County have nothing to do with what's happening here. They're because of manufacturing upwind from here, or they're because of other environmental factors. There are small things at the micro level that we can do here. It may be dust control on construction sites, things like that, and those are messages that we work on. The Community Health Needs Assessment and Improvement Planning is the next layer of data that I want to talk a little bit about. You've probably heard about these terms maybe ad nauseum, because we talk about that a lot at the Health Department, the CHNA and the CHIP. And that's because they're really important. And there is federal legislation that requires nonprofit healthcare systems to do a community health needs assessment every 3 years. There on the right of the slide, you see the 5 nonprofit healthcare systems who this applies to. The Health Department is also required to do a needs assessment for our accreditation. And so we decided about 13 years ago now that it would be a really bad idea for there to be 6 large surveys going on in the community and not very effective. And so thankfully, with the spirit of West Michigan collaboration, we all pool together, and they all contribute financially and with in-kind resources to the Health Department leading our needs assessing. And we just finished the last, it happens every 3 years, we just finished the 2023 version here recently. That needs assessment is a way of gathering data and hearing from the community what their priorities are. And then the improvement plan is action on those priorities. Those nonprofit healthcare systems need to contribute community benefit dollars towards moving the ball in the prioritized areas. And in 2023, our community, through that needs assessment, prioritized these issues. And the percentage is the number of times that survey respondents mentioned, the percentage of respondents who mentioned these as priorities, and consistent with the conversation previously, housing is right at the top as an important factor affecting the health of the community. Health insurance and access to medical care may seem like the same thing, but there's a lot of overlap, but there is some difference. Having health insurance is a measure in and of itself, but some people have health insurance and they still don't have access because they can't get in to a provider's office because of wait times or other factors, language perhaps. Mental health continues to, healthy food's a priority, mental health. We're trying to focus on those items that had double-digit support here when it comes to what are we going to build a strategic plan around in partnership with those healthcare systems. And we're working on that. That work is beginning right now. You're going to hear more about that in the near future. But I want to do a little bit of a dive into a couple of these issues. The first is housing, which, no surprise to all of you here, is more expensive and less accessible than it ever has been. This graph shows the percentage of homes that were under $150,000 and the rental units under $1,000. And you can see since 2018, both of those have come down quite substantially. And that latest number is from 2022, and we all know that those numbers have certainly gone down in the last year and a half as well. But as we saw with life expectancy, the experience here is not equally felt. So when we asked the survey response for the community health needs assessment, which is over 5,000 residents in our community, and it quite neatly matched our population demographics of where people live, their age, their race, their gender, all of these factors, we see that the percentage of people who say that they were unable to pay their housing expenses in the past 12 months stayed about the same overall, went from 8% to 9%, went down a little bit for our white respondents. For people who identify as Black and Hispanic, the number went up pretty substantially over the course of the past 3 years. When we talk about access to health care, overall, our measures here looked pretty good. In 2020, we had 19% who said they had no checkup in the past 12 months, 13% who had no primary care provider, 9% who had no access due to cost, and we see all of these overall are trending in the right direction. That's very positive. However, again, the common theme here is that those improvements have not been equitable. And when I use the term equitable here, I mean that not every group has the same ownership in this progress. And so you can see that with no routine checkup, the percentage of people who identify as Hispanic and white has gone down, which is good. However, the respondents who identify as Black went up from 7% to 12%. Very similar with no health care access due to cost, where Hispanic and white respondents, fewer say that that's a restriction now, where the number went up for our Black survey respondents. Moving on to overdose deaths. This is one of the most severe epidemics and crises that our nation has had in quite some time. In particular, the opioid and now the opioid fentanyl crisis that we have. This is the data from the last year. And you can see total drug overdose deaths for Kent County residents, we had 106. 67% of them involved opioids. The average age of an overdose was about 45 years. But when we look at polysubstances, which is where there's more than one substance involved in the fatality, we see that fentanyl, in particular, cocaine to a lesser degree, but fentanyl was involved in 61 of those deaths, or 86% of our opioid overdose deaths, which is pretty concerning for us. Cocaine is also significant. Xylazine is on the increase. There at the bottom, you can see that methamphetamines and fentanyl is about 33% of our methamphetamine overdoses, and cocaine and fentanyl is also pretty significant, with 62% of cocaine overdoses also including fentanyl. A lot of reasons for that, but ultimately it comes back to the economics of these substances and how those who are dealing them and profiting from their trafficking in our community and communities everywhere are getting the effect by cutting substances, more expensive substances like cocaine and heroin, with with less expensive but very effective or impactful substances like fentanyl. Our overdose demographics, largely male. You can see 56 of those overdose were male in the past year. There you've got the age group breakdown. Race and ethnicity is important here. You can see that the majority of the overdoses have been white residents. However, the rate, which is measured in the number per 100,000 population, has gone up pretty significantly in the past few years for our Black residents, where it's actually at about 3 or 4 times higher than the rate for our white residents, which is an interesting development in this battle with opioids, because in the early years, 7, 8 years ago, this was largely an epidemic facing our white residents exclusively, and now it's really affecting families regardless of race in our community. Here you have a table looking at, or graph looking at the overall rate or number of deaths per year going back to 2005. So you can see how in the mid-teens, we here and elsewhere saw a significant increase in the number of deaths in the community. 2017 was our worst year here in Kent County. That was the same year that I called together our Kent County Opioid Task Force, which has really done tremendous work. And you can see how that curve kind of flattened, and hopefully we saw in 2023 a reduction in the number of deaths due to opioid overdose, and we're hoping that this signals the beginning of the end or the next chapter in this crisis. And I just want to give a shout out to that opioid task force that's led by Rachel Jantz, who's the epidemiologist that this board created about 7 or 8 years ago, along with Dr. Jane Kortz, who is a physician at Trinity Health. Has about 30 different organizations from law enforcement and education and public service and nonprofits who all contribute to making our community a better place or better prepared to deal with this crisis. And our opioid overdose fatality review group, which does what we call a social autopsy of each of these tragedies to try to find were there things upstream from the overdose. Were there opportunities for intervention that were missed? And then trying to invest in making a difference in those areas. And these groups and those conversations largely influence and fed into the spending plan for the settlement dollars that you're going to be receiving and talking about in the coming weeks. Real quickly, some significant accomplishments. Lead, we all know how much of a challenge that has been and will continue to be for a long time. One thing we know here in Kent County is that contaminated water is not the primary source of our problem. However, there are older homes and some homes that do have fixtures or who have plumbing inside the home that can be a slice of that pie. In many ways, that can be low-hanging fruit. And so last year we partnered with the state of Michigan and the city of Grand Rapids to offer lead water filters that would reduce the lead, and made those available to people that had a home built prior to '78, who had children in the home, who either had a person who was on Medicaid or a home that otherwise said they can't afford getting a filter at the store. And we figured there was about 18,000 homes in total that would qualify for this. And so we made these distribution events in the community and a lot of other outreach to get these filters out there. And to date, we've distributed almost 12,000. And so we're really proud of that work. And it was led by Sarah Simmons, who's in the back, and our environmental health team did a tremendous job getting those filters out. The wastewater surveillance program. Just recently, a couple months ago, you reallocated money back into this program that Grand Valley leads in partnership with us to do surveillance of wastewater, looking for indicators of infectious disease. A quick story that was a real success from this is earlier this year, this is the Veterans Home, and that's one of the points where we collect wastewater for surveillance outside of the home. The lab saw a spike in the volume of norovirus coming from that facility. And that empowered us to contact them and to say, how are things? Are you seeing illnesses? They said, yeah, in fact, we do have a few people who are sick right now. And we said, well, we think it's norovirus, and we think that we can help you by isolation and disinfection. And so we coached them and worked with them very carefully, and I think did a good job in partnership with them to keep that to a minimum, and so that we didn't have residents there that were affected unnecessarily. Food safety licensing. As I'm sure you know, all restaurants require a license issued by the state of Michigan to serve food. They contract with us to do that actual licensing work and do the inspections, as you know. Normally, the licensing expiration and renewal period is incredibly stressful for us and for them. We don't historically get a lot of notice from the state. The turnaround time is fast, and at the end, we always end up with several dozen who are really panicked at the last moment to get their paperwork in, get their application fee paid. And then there are always a handful that have to close for several days or a week until they get that stuff taken care of. It's really pretty tragic every year. This year, our environmental health team, again, led by Sarah, worked on a quality improvement plan with better communication. And while some things were out of our control at the state level and elsewhere, the things that were in our control, we improved on. And this year, I'm happy to report, we had 0 restaurants that had to close because their paperwork or their fee wasn't paid on time. We're really proud about that. And the last thing I want to share is just a fun one. It's been decades since we had large public health conferences here in Grand Rapids, national conferences. Back in 2017, I was on the board of directors with the National Environmental Health Association and worked really hard to bring that annual education conference here. Well, it turns out these associations talk to one another, and we've had several since then. And right now, across the street at the Amway and DeVos place, we have the American Association of Food and Drug Officials here in town. About 600 people filling our hotels, filling our restaurants, and we're really excited about that. In fact, I spoke to a couple of downtown restaurant owners, letting them know that you're going to have 600 people here in town. That's the good news. The bad news is that they're mostly restaurant inspectors, so so do well. Lots of good news, though, to share. Some significant challenges. This is a new challenge, but also an old challenge, measles. And thankfully, we have not seen a case here yet, although the numbers continue to climb across the nation. It is particularly challenging because measles is so contagious, and it can be so devastating. Right now, nationally, of those who've had measles, about 20% have required hospitalization. So it's pretty serious. And many of our providers and hospitals haven't seen a case of measles because it's been so rare for 20 plus years. So we are working with them to make sure they can identify measles clinically quickly and also report it to us so that we can work quickly to make sure it stays isolated. This little gal looks like a mosquito, and it is a mosquito. It's a mosquito called Aedes albopictus, the Asian tiger mosquito, and as you may guess from its name, doesn't belong here. We have enough mosquitoes of our own, and they spread enough illnesses without help from invasive species, which this is one of. It's a species of mosquito that's been working its way through the Americas for the past number of years. We had not seen it until last year. And last summer, we found about 10 of these here in Grand Rapids. It's concerning because they are very good vectors of diseases like yellow fever and dengue and chikungunya and a number of others. We're hoping that and I think entomologists are hoping that they can't sustain our cold weather here in the north. However, we had a really mild winter, and I'm concerned that it might not have been intense enough to knock these suckers out. So we're keeping an eye out for that. And then, of course, you've heard an awful lot about highly pathogenic avian influenza in the news over the past month or so. While we don't think that it's going to be a significant threat to human health, it is something because it's an influenza virus, which is very prone to mutation to do that. Hopefully it stays as one more thing we're just keeping an eye on, but it is something that we're watching very closely along with partners at the state and federal level. So with that, I know I have, like always, Chair, my apologies, I have blown past all time limits, but I'll stop there.
Well, Adam, thank you. There's a few of you that get a little extra time, so you are one of those, so I appreciate the presentation. Commissioner Baker.
Yeah, just this is very thorough. I really appreciate this. Have you had any thoughts on some of the equity issues, especially like on slide 11, the improvements, not equitable in terms of healthcare access? What's happened that's caused, well, it looks like in some respects, whites and Hispanics have both improved, but African Americans have not. You have any analysis of what's happening with that access to?
Yeah, so I'm a little surprised at not surprised that disparity exists, but surprised that it appears to be as great as it was. We're asking those questions now and working together with those healthcare systems as we form that chip to figure, okay, so what's the why behind this, and how do we choose our punches in a way that most effectively deals with the challenge here?
Okay.
Thank you, Chair Burrow. In your overdose list, you had a drug called Xylene. I've never heard of such a thing, and is there a street name? What is that?
Tranq is the street name, Tranq.
Tranq.
Yeah, and it originates in normal use as a veterinary drug. Yeah, and so it's one of, so when we talk about things like fentanyl and xylazine, they're very effective they do a tremendous job in causing the sort of effects that people who are after these drugs want. The challenge is their extreme potency. Now, those things are attractive to people who manufacture and traffic in these things because they're very effective and they've been easy to access. So they're relatively inexpensive compared to heroin and cocaine and other opioid prescription products. So that's the problem, is make sure that the streams of access, whether it's veterinary or trafficking from other parts of the world that aren't properly controlled, making sure those are not available to people who are manufacturing. Yeah, but it's meant for animals, so it's clearly dangerous, very dangerous for people.
All right, Commissioner Ponstein.
Thank you, Chair Burrow. Adam, thanks for being here today. I have to agree with you that this format's a little bit better. The Health Department covers so many things, and to key in on three, I really appreciate that, because these topics were very important. I'm not going to talk much about the drug abuse. I sit on the Substance Abuse Advisory Board for the regional entity. I've always been under the belief that death should never be the punishment for addiction and those that are suffering from it. But, the level of drugs that are coming in, and it's sad that, these are like commodities now, where it costs cheaper to do this one, so let's find a way to cut and fill and add, and the meth that they're making now is about 10 times more stronger, maybe even more than that, than it has been, and it's, every time we attack one area, another area changes. So I appreciate the work, and I appreciate the downtick in the amount of overdoses. There is hopefully light at the end of the tunnel, but I'm not too sure. The one thing that I wanted to key in is your first part about our life expectancy, and I can appreciate where we're at, but I'm more curious. I've done a lot of research into the blue zones across the world where people live to be 100. A lot of their success stories are things like diet, exercise, and community. And when I use the word community, it's not the community around, but people, how they interact and go for walks and just simple things like that. Do you know who is up on that top echelon, the top 5%? Are there trends that they're doing that are different, instead of getting, we've got this problem in this area, we're going to attack that? Is there some beliefs out there that there's something else out there that's triggering these areas that they are living longer? I know that's a loaded question. So.
It's a big conversation. I've also read the Blue Zones and familiar with that work, and I think that there's a lot of value in that. And as I recall, I think there were 9 different categories that the investigator found were similar between these areas, where people disproportionately live to be 100 years old. And you touched on a couple that I think are really important, are cultural diets and socialization, belonging to social groups, having a community and having a sense of purpose in life. And I think that when we look at that 16+ year gap here, I think that those are things we need to think about and explore more. I know many of the first and second generation people who come here from places like Asia and from other nations. We saw Hispanic members of our community also are living heavily greater than life expectancy. They're bringing a lot of those food traditions and social traditions with them that are very powerful. Now the challenge is oftentimes those things get lost in 3rd and 4th generations, and then we have return to the average. And so I think that these are things that we ought to be exploring further and advocating for in our community. How do we become a place where we are celebrating and encouraging those food traditions which are low in refined sugars, have greater proportions of vegetables and lean meats and fewer processed foods and more water and all of the things that we know are consistent with longer life expectancy.
Okay, thank you.
All right, thank you. Commissioner Hennessy.
Sort of skipped over, it was kind of interesting that you said there were no
I think this is the second year, Sarah, I think this is the second year where we have had the fees. There were 2 years, I think it was 2021 and 2023. We have had fees, Sarah?
Correct. Correct. Yes. So, I'm sorry, I couldn't hear your question very well because your mic's not on. I couldn't hear your question very well because your mic wasn't on.
Oh, sorry.
Yeah.
I didn't have it on. The restaurant fees.
Yes.
It's not really seeming to cause a real hardship now that we've reinstituted the charging of them.
Well,
charges.
no, I don't. We've actually seen since 2019 an 18% increase in work in food safety. So that means that we've had an increase in restaurants coming into our community. And we haven't heard an expressed, I think that there are always going to be restaurants that struggle just for various different reasons. But we didn't hear it this year like we have in the past with people struggling and being able to bring in revenue to bring in, to pay for food fees. And I note too that we actually have some of the lowest food fees in the region for restaurant owners. So comparatively speaking with our neighbors, so it's a little bit more affordable and accessible here to be able to become a restaurant owner.
That's interesting. Thank you. Adam sort of mentioned it a little bit, and I thought I'd ask more. But while you're out here, Sarah, septics is always, even for us who are, represent city areas, is something that we always get questions on.
Yes.
And there's been a move to change the state legislation to do
Yes.
more septic inspections. Is that going anywhere that you know of?
We are, Adam and I actually had the opportunity to review the fourth draft of the legislation to do that, so there is momentum on that. So what that would do is that would create what we currently don't have in the state of Michigan is a statewide sanitary code, which regulates all septic systems in the state of Michigan. It's handled on the local level. And so what this regulation would do would then create a statewide standard for regulating septic systems, which would be beneficial to our, not only our public health, but also our environment and maintaining our natural resources. So in our community, I think it would be a good thing. I think that there's the devil's in the details. So what this would do is this would put homeowners on a frequency that's yet to be determined or finalized for inspecting their septic systems on their property and create a potential revenue or economy for private inspectors to do the work, as well as partnering with local health to be able to supplement if needed and then provide oversight. It raises the bar in terms of educational requirements of people doing the work and creates a standardization that across the state of what the requirements are for an inspection of a septic system. So I think overall, conceptually, it's a really, really great idea. But again, it's kind of the devil's in the details and how it's implemented.
But you said it's on a fourth reading, so that means that there's more agreement being formed?
A lot more agreement. Yes. Yeah, it started out pretty rough, I'll be honest. It wasn't really palatable, and it was going to be really quite expensive for any local entity to be able to implement that type of regulation. For Kent County, we were looking at around $4 million to implement. And we, going back and, asking what are the funding mechanisms, how is this going to be implemented? Does it have to be as, it was very, I'm trying to think of a word to say it without, it was very progressive, if you will, in the way that they wanted to do it. It really wouldn't have been palatable to the public, I don't think, in the way it first was going out. So I think we've gotten to a point where it could be palatable to, it could be palatable to the public, as well as it's much more, they're thinking about the funding, they're putting good thought into the funding mechanisms, and also not only funding mechanisms for local health to do the work, but also funding mechanisms to help people in need who may have to replace a septic system as well. So those are kind of again, it's kind of the details and the nuance, but it's in a better place. Remains to be seen what will happen. Anything you want to add? Okay. Yeah.
Thank you. I appreciate that. We should have thought about it when Becky was here, but you're bringing it up in your report. It's part of the health department report. Was really good, and I really liked the format for today's report and the materials we were given. It's like it told us a story, and it's much easier to remember and to really, can really identify it a lot better and can see things really well. I thought the opioid information was really interesting in that, we associate drugs and problems with youth, and this is sort of a middle-aged type of problem. So I thought that was really interesting. That was one of the stories that I gained out of this. The other thing I noticed, we changed our logo a year or two ago, and you've adapted it, and I liked it, but can you explain the idea of it?
Absolutely. And thank you for noticing. That actually plays on the symbol for public health, which is a three-sided shield for promote, protect, and prevent. And then in the middle is the exalted human form. It's a person looking joyful, or the form of a human is joyful. And that actually plays off of the cross that's within the national symbol for public health, which is supposed to reflect the human form. So it really plays on that symbolism of the national symbols for public health.
I really like that. Thank you very much.
Thanks.
All right, thank you, Commissioner. Commissioner Diaz.
Thank you, Chair. I had two questions. One of them you covered at the end of the presentation in regards to the bird flu and keeping an eye out for that. And then the rest of it was kind of taken by Commissioner Ponstein. But in regards to some of the things that were in the presentation when it comes to some of the top concerns, I guess, specifically around housing and around access to healthy food. Do you have any thoughts on any policies that would be helpful in addressing those concerns, not at the state level, not around rent stabilization or universal health care, but things that this body can do to address some of those areas that are really affecting the public's health?
Great question. And again, it probably requires a longer conversation, but I would be careful from our perspective, because I know so much work has been done in the area of housing, and there are some great initiatives in the community that are already happening. That now, from a public health perspective and from a community health perspective from the hospitals, they're recognizing this as a precursor for so many of the things that are a burden on a number of health outcomes. And I think the conversation we're having now from a health perspective is, how do we engage in the conversation that's productive and is not duplicative or doesn't undermine things that are already happening. So I would say that we want to be part of that conversation. We're probably not at a point where we can say, here's a policy, or this is a policy that we think would be useful, but we want to get there in collaboration with those who are doing so much work on the other factors of this issue. It touches everything.
Yeah, that makes sense.
Yeah.
Thank you.
All right, any other commissioners? All right, seeing none, Adam, thank you very much. Great report. I agree with everyone here. Very well done, very informative, and again, 88 to 81 to 71. I mean, that's a big age gap there. I thought that was a great information for us to have to continue to figure out what we need to do to be a healthy Kent County. So again, appreciate your time.
Thank you.
All right, next item on our agenda is brought to us by the Administrator's Office, Employee Business Expense Policy. Do I have a motion, please? Motion by DeBoer, support by Pakla. Commissioners, comments, questions, or concerns? Commissioner Ponstein. Saw that hand going up, so.
Well, I thought I'd do the trifecta and speak to all three things today, So when you think of travel for employees and even elected officials, are all the things we're doing, I read over that document last night, and there's more red lines than what's left. But still, I mean, is that policy there to encourage people to travel, go to seminars to try to be a better employee? Or after you read it, do you think, I don't want the headaches? And I've got a couple follow-ups, but that's the main scope of this thing, is that travel has gotten to a point where it's just not fun. And it's not just this policy, but, getting there, getting back, is there a delay? Did the plane flight get canceled? Did your luggage get there? are the restaurants open even? And the restaurants that are there, staff printed off what the reimbursements rate, and obviously I've been fortunate that someone else has been paying my travel expenses and not the county. I just look at the rates of reimbursement. They've got, like, breakfast is like $13. I mean, if you're staying at a hotel, I mean, you're gonna be lucky if your breakfast is under 20. And all of these regions, to make up the difference, it's coming out of an employee's own personal funds to try to better themselves and this county by going to these conferences, and a lot of them are very effective, so that's maybe to, add on to that beginning question, but that's just kind of where I'm looking at, and
Sure. Yeah, no, I can tell you that it wasn't written in the spirit of trying to discourage employees to travel.
Okay.
So that's, I think that, we're a big organization, we have a lot of employees eligible to travel, and so we are trying to be judicious in how we, and we want clean reporting. We need to have the kinds of policies that, are as straightforward as we can make them for people to follow. One of the improvements we intend to make as soon as some changes to our computer system will allow is I intend to change the procedures to allow for a per diem instead of kind of right now, we call it the scrapbook. You have to put in, a receipt for every single thing, and that can be a little tedious. So I think by going to a per diem, that will make travel quite a bit simpler, I think, from a reporting standpoint. And so we can't do that quite yet. I'm not sure exactly when. I'm sure hoping by the end of the year we can get that done. But I do know it takes some changes to our computer to do that.
on the amounts that we do, have we ever, like, reached out to, Experience Grand Rapids and see if our numbers are in line? Because, this area, when you go out to eat, you can't even begin to compare if you were in a larger city, just what the costs are. So maybe just, I don't know how we compel that information or who we get it from, but it might try to get a better grasp on that, because I don't want someone not to go to an educational experience because of something like that. And when an employee does go, what is the average turnaround for reimbursement? If they're charging all this to their own credit card and, the reimbursement comes 4 or 5 weeks later, and the credit card's already charging interest on what they've already paid. I mean, is that simple to, when you turn it in, that it's got to be addressed quickly, or is there a backlog?
So 2 answers to that, and I'll turn to Jeff maybe as far as how quick that turnaround happens. Personally, it's within 2 weeks. I know when I was putting that in, we have expanded the use of pay cards to departments. So more items are put on a county pay card than what had been happening in the past. Jeff, do you happen to know the turnaround on average countywide for employee requests for reimbursements for travel?
Yeah, good morning, Commissioner. I don't know the direct turnaround time, but as soon as they get it into our department, we have staff that review it and get it into the payroll system so that it gets reimbursed through their payroll process. So it's fairly quick. I haven't heard any complaints about people waiting too long and having to pay their own thing. As far as the rates, the federal government puts out the rates, and there's tier 2, tier 1, and tier 2 cities. So the tier 1 cities are a higher reimbursement rate because they're more expensive. So that's all established by the federal government, and that's what we try to follow. So.
All right, any other commissioners? All right, we do have a motion and support on the floor. All those in favor, please say yes. Yes. All those opposed? That has been approved and will move to board this week. Commissioner Miscellaneous. Any Commissioner Miscellaneous? All right, seeing none. Oh, Commissioner Diaz.
Thank you,
Snuck
Chair.
that in.
Yeah, just really quickly. I know that since our last meeting, there were some updates in the unfortunate cases of the young men who were killed in interactions with police officers. The young man, Riley Doggett, who was, I don't know if struck is the right word, but who was killed in interaction with the Kent County Sheriff's deputy. The prosecutor decided not to charge that deputy in that interaction. I personally waited until I could see the images from both cases, and I personally think that there is a clear distinction between both cases. With that being said, though, I was hoping that whether it's at our next legislative meeting or the next time that the sheriff is present, that she could tell us if there are any plans, any ideas, any changes in policy that she is considering after this case. You've had instances from around the country where law enforcement is interacting with an individual, where potentially that individual, specifically with a vehicle, ends up being killed. And I know that there's, certainly instances where an individual presents a threat to the community, in which case the law enforcement officer needs to act quickly. In this case, I do not believe that that was the case. So I'm going to respect the decision by the prosecutor, but I do believe personally that there should be changes in policy when it comes to when is it better to continue to chase down an individual who may or may not present a threat to the public. Again, just reiterating, next time that the sheriff is here or when she gets a chance, I would like to hear from her just to see what her thoughts are around this case. Thank you.
Any other commissioner miscellaneous? All right, I think Al, did you say you had, I hear you say you had something? Okay. If not, meeting is adjourned.